Good afternoon, everybody. Thank you, Richard, for that introduction. I'm delighted to be here as the Executive Director of SC1, and what I'm going to do for the next 15 minutes is walk you through what the process we're going through to build a global life science innovation district in central London. And as you can see from the title, it's quite visionary. We are trying to build a global life science district right here in central London. When we reflect on SC1, SC1 is really made up of 7 illustrious founding partners. King's Health Partners, which is made up of clearly King's College London, 3 incredible NHS trusts, Guy's and St. Thomas, King's College Hospital, and South London and Mosley NHS Foundation Trust. Equally important, within SC1, we have the active engagement and collaboration of our 2 boroughs where we're based, that is Lambeth and Southwark. And last but certainly not least, we have the unique engagement of a charity known as the Guy's and St. Thomas's Foundation. So we are here built on a phenomenal foundation to become a global life sciences innovation district. What is our vision? Our vision is simple but quite bold. We want to create a transformative life science ecosystem in central London dedicated to innovation, creative partnerships, and to improve life for our local and global communities. There are 3 key phrases in here that hopefully in the next 10-15 minutes will come to life for you, and it will no longer appear like a very abstract vision statement. The 3 key phrases within the vision statement are really about innovation, creative partnerships, and I think the key phrase here or word is creative. And last but certainly not least is we're committed to improving the life for our local and global communities by becoming exemplars of what a great innovation district looks like. And as far as I'm concerned, one of the best cities in the world, London. So SC1, as I mentioned, builds on the great partnership from King's Health Partners that's been around for over a decade. Not only that, we have built on the UK life sciences vision with its 7 missions. When I reflect back on the depth and breadth of the offerings within King's Health Partners, we do have core competencies and presence across cancer, dementia, mental health, obesity, respiratory diseases. So we have a very strong presence to really contribute to the broader UK community in terms of fulfilling the 7 missions. As I mentioned, for SC1, I do see an opportunity for us to take leadership not only within the Golden Triangle, so have a leadership position when we are looked upon in the same sentences as Oxford and Cambridge here in the UK, but equally important is that there is an opportunity for us to lead globally within central London. For this to happen, though, we need to look at creative ways of collaborating across the sectors. And this is one of the most important things that has come out of the pandemic, which is the importance of collaboration effectively across the sectors, meaning academia, the industry, and the nonprofit sectors. So why do I think SC1 is uniquely qualified to take a leadership role, not only nationally, but globally? Let me walk you through this somewhat simple, but I think important slide. I think it begins with what we have here, a world-leading university, King's College London. That's really a phenomenal foundation to build on. When we look further, we also have academic, research, and clinical leadership in pivotal areas. You'll see that in my next few slides as I review the hubs, leadership in areas that are incredibly important for patients, the community, and the world. Equally important, we have a diverse patient and people population here in Lambeth and Southwark. And as I mentioned, the active engagement of our 2 boroughs, which is really critical. To build on that, we also have what is often considered as a national treasure here in the UK, the NHS, with its associated data sets that is unique in terms of a healthcare ecosystem nationally. Not to mention, we also have access to genomics, the biobank, and the AI center here. So lots to build on. And then in doing some due diligence as I prepared to take on this opportunity, I was really heartened by the sheer depth and breadth of ongoing initiatives that really have looked at transcending innovation. So that's a really great foundation to build on. And the question is, how do we build on it, make it more impactful, and make sure that it resonates globally? And with that, I'm often asked, what is our value proposition, Georgina? What makes us unique? What is our mission? And it's really actually quite simple. It's this tagline that you see at the bottom of every slide. What we want to be accomplished is to reimagine innovation and health equity. This is one of those simple phrases that has a lot of thought that goes into it, because we want to take how we're currently doing things and really elevate them and be future-proof 10, 20 years out from now. Equally important, we want to have the lens of health equity to all our initiatives, which means that anytime we take on a partnership approach, anything we do in SC1, we have to be asking ourselves, how is this going to contribute to health equity both locally and globally? That is really the mission in everything that we do. How do we reimagine innovation and health equity? As I mentioned, our borough is at the forefront of SC1. They're embedded in all our initiatives, and this slide summarizes the depth and breadth of the diversity of the populations we have here. We literally have a very diverse ethnic background group of people. There's 120 to 150 languages spoken here. Not only that, we are based in what I consider the best parts of London, very, very culturally rich parts of London where we have our 3 hubs. I don't know of any other innovation district in the UK or in the world that can reflect on having such excellence across these 3 hubs. The first is Westminster Bridge. That is our MedTech Hub. I don't need to tell this group here based in the UK what Westminster Bridge stands for in terms of the cultural icons that are there. Second, we've got London Bridge, which is known as our Biomedical Hub, with excellent leadership there in terms of cancer therapy. And last but certainly not least is Denmark Hill, our Mind and Body Hub, which is a bit of a misnomer because having been out there to Denmark Hill and engaged with some of the incredible people that work there, not only do we have excellence in neuroscience and mental health, but we also have leadership in hematology, hepatology. And what I've also learned is this is one of the world-class centers for fetal medicine. So kudos to Denmark Hill for having such excellent leadership across so many different important therapeutic areas. As I mentioned, in the interest of time, I'm not going to be able to go through each hub and what it has, but this is simply a slide to really kind of structure the extensive offerings that we have in each hub in terms of the academic excellence, the research excellence, the spin-outs that have been generated from each hub, the key industry partnerships that have already materialized, our equally exciting strategic estates developments that are there, all cultural events and icons that are within a doorstep of where we're located, and the many, many different what we're calling connectors and facilitators, both local and global organizations that will help us fulfill the SC1 vision. Right? So briefly on the MedTech Hub, we've got the King's School of Biomedical Engineering. By next year, we're going to have a phenomenal organization and building called the London Institute for Healthcare Engineering, which is really going to be a very forward-looking approach to how do you really engage with innovators, entrepreneurs, along with the NHS and academia. We've got a development called Royal Street, which is going to be one of those exemplary health districts to really build on what we currently have, as well as Block 9 Extension. We currently have great collaborations with NVIDIA, Medtronic, and GSK. And of course, we've got KHP Ventures based out of our MedTech Hub, which I'm sure you'll hear about a lot more from Daniel Dickens later on. When we shift to our Biomedical Hub out of London Bridge, again, some phenomenal work happening in terms of cancer therapy, some collaborations with Pfizer, USB. We've got some excellent spin-outs, Quell Therapeutics, phenomenal Gamma Delta Therapeutics. We've also got an estates development, Snowfields Corner, that we're building on, as well as Vinegar Yards and Newcomen Street. Clearly, many, many, many things within this hub. And as I mentioned, last but certainly not least, our Mind and Body Hub at King's College Hospital and SLAM. We've got a phenomenal spin-out that's come out of there from Professor Dr. Chris Shaw. It's called Avio de Bio. I'm going to mispronounce that. That's actually been recognized as a Fierce 15 biotech company. I spent a good 2 decades in my career with big pharma and biotech. That's essentially the holy grail publication for the biotech industry. So for one of our spinouts to be considered a Fierce 15 biotech is a really phenomenal acknowledgement. We've got what's going to happen next year is the launch of the Paris Modley Center for Children and Healthcare and Young People, which is really, really important because I think what the COVID elucidated is that we have a health crisis here with mental health. So how are we going to fulfill the vision of SC1? The short answer, it's going to take a lot of collaboration and teamwork internally across the 7 founding partners, and equally important across the different sectors. So I've got here what we've called our 5 pillars. The first one is really about our value proposition. Why choose SC1? I think internally we all need to be aligned on that and communicate that to our stakeholders, our team members, as we get out there. And I'll speak a little bit more about that. Equally important is what I'm calling our partnership strategy, and this is like a macro view of our partnership strategy. The third pillar is called entrepreneurship enterprises, which is how do we become the go-to ecosystem for founders, entrepreneurs, and small companies. We've got our overall estate strategy, which is how do we position our various offerings across the 3 hubs from a short and long-term view. And our 5th pillar, which is last but certainly not least, is what we're calling our employment and skill strategy, which is how do we make sure that we're leveraging local talent. So all those great jobs that we're going to have in life sciences go to members of our local community in Lambeth and Southwark. So I'll do a quick deep dive into the various pillars. When we talk about the SC1 value proposition, the most important thing here that will be launched by the end of the year that is really important is a refined logo and branding that aligns with the mission of reimagining innovation and health equity. But equally important is a message house. A message house is simply how do we all speak with one voice around the SC1 vision in terms of speaking with various stakeholders. This is really important, and what are the associated proof points that speak to it in a credible fashion with external stakeholders. When we look at the partnership strategy, what we hope to do is to build on the local current partnerships that are happening and build larger and more impactful global partnerships. When we look at partnering, for me, it's really important that our external partners meet 2 what I would consider non-negotiable criteria. Are they aligned with our vision, and are they aligned with our mission and values? And are they committed to transcending health equity? When I look a little bit further in terms of targeting big pharma and big tech, there are many, many opportunities to collaborate with these stakeholders around 3 key areas that we've got excellent clinical and academic leadership. The first is mental health and neuroscience. The second is oncology and hematology. And the last is cardiovascular. As I mentioned, we have excellence across many other areas, but as anybody will tell you, good strategy is about focusing and picking areas where you're really going to do some impactful things on a long-term basis incredibly well. And what I hope when we do execute these key partnerships is that we become global case studies for how do we transcend health equity. When I think about how do we become the go-to place for entrepreneurs and founders, there's really 4 different dimensions to that. Do we have the right accelerators in place to support our founders and entrepreneurs? Do we have the right incubator space? Do we have an anchor accelerator, which is really a pillar in most key innovation districts that really associates one of our key academic areas of excellence to SC1 specifically? And last but certainly not least, do we have the key things like funds and resources and advice? And KHP Ventures has been quite instrumental in this and contributing to this ecosystem that I think is important. Again, this is about how do we competitively position all these offerings. They exist, we need to build on them and add some new additional ones. But when we think about the customer perspective, does an entrepreneur know where to go with an SC1 to make their company successful? And again, last but certainly not least, we're working with the 2 boroughs to really figure out what is our area of focus that we can really champion to have an impact on the local community for an employment and skills strategy. Our adoptable estate strategy, you'll hear more about that later on today, is really important, and we have several developments in place that I spoke about, right? And I want to close by, I guess, answering a question that I often get asked. So, Georgina, what does success look like? And I like the question, but I also like it when people ask me, what does success look like long-term? Because SC1 is not a short-term project. It's not a trend. It's a legitimate global innovation district that is in the happening. So for me, it's about, are we in the same sentence as the iconic Boston and Toronto biotechs, but for different reasons? Have we co-created unique large-scale partnerships that become gold standards? Are we the first choice for the entrepreneurs locally and globally? Equally important, have we positively impacted the two boroughs, Lambeth and Southwark, in terms of key metrics that matter to them? Last but certainly not least, this is something I'm very passionate about, that we're recognized by the World Economic Forum for having really moved the needle on health equity at a local and global level, that we become a true global case study with measurable outcomes and how we've actually reimagined innovation and health equity. With that, I thank you for your time. And yes, I've had the privilege of spending the summer all over the 3 hubs, and I encourage you to reach out if you have any questions. I'm based out of Counting House, but certainly have had the pleasure of making my way around the 3 hubs. Thank you very much.